Let me start by saying something that might feel uncomfortable, but it's important. When you're having trouble during sex, it affects everything. You're stressed about it. You're thinking about it constantly. And instead of being present with your partner, you're worrying about whether your body will work the way it used to. I'm Dr. Rachel Morgan, a urologist, and I've spent years helping men navigate these exact concerns. And here's what I want you to know right from the start. You're not alone, not even close. Today, we're going to talk about something men ask me about all the time, but rarely discuss openly. How hard should your erection actually be? Is there a difference between hard enough and rock hard? And more importantly, what does it mean if things aren't as firm as they used to be? We're going to cover how doctors actually measure erection strength, what different levels of hardness mean for your health, and most importantly, what you can do about it if you're concerned. By the end of this video, you'll have clear, honest answers, and you'll know exactly what steps to take next. Before we dive in, I need your help for just 10 seconds. Please write in the comments where you're watching from and how old you are. This is really important. It helps me create future content that's going to be the most useful for you specifically. Let me start by explaining something that might surprise you. Doctors actually have a way to measure how hard an erection is. It's called the Erection Hardness score, and it goes from 1 to 4. Think of it like a scale from soft to rock hard. Grade 1 means your penis is getting larger, but it's not hard enough for sex. It's like when you feel some blood flow starting, but there's no firmness. You can't penetrate with this level of hardness. And if this is where you're at most of the time, it's definitely worth talking to a doctor about. Grade 2 means you're hard enough for sex, but not completely hard. Think of it this way. You can penetrate, but it takes some effort. Maybe you need to guide it in, or maybe you lose some firmness partway through. This is the level where a lot of men start to worry, because it's just enough to work, but not enough to feel confident. Grade 3 means you're mostly hard and can have sex without much difficulty. This is where most guys feel pretty good about things. You're firm enough that everything works smoothly, and you feel confident. But you know, it's not quite as rigid as it could be. Grade 4 is what we call completely rigid, rock hard. This is the firmness you probably remember from your younger years. It's the kind of erection that feels strong, confident, and doesn't require any help or adjustment. Now, here's what I want you to understand. These grades aren't judgments. They're just a way to communicate clearly with your doctor about what you're experiencing. The most important question isn't, am I at grade 4? It's, am I happy with my erections and is my partner satisfied? Because here's the truth. Grade 3 is perfectly fine for most men and their partners. You don't need to be rock hard 100% of the time to have great, satisfying sex. But if you're consistently at grade 1 or 2, or if you used to be at grade 4 and now you're at grade 2, that's a signal your body is trying to send you. And it's worth listening to. So why do things change? Why might you notice that your erections aren't as firm as they used to be? There are really two main categories: physical causes and emotional causes. And honestly, they're almost always connected. Physical causes include things like blood flow problems. Your erection is basically a blood flow event. Blood needs to rush into your penis and stay there. If your blood vessels are stiff, narrow, or clogged, which can happen with age, high blood pressure, diabetes, or high cholesterol, less blood gets in, and firmness suffers. There are also nerve issues. The signals from your brain to your penis travel through nerves. If those nerves are damaged or not working as well, maybe from diabetes, surgery, or just aging, the signals get weaker, and so do your erections. And then there are hormones. Testosterone plays a big role in your sex drive and your ability to get hard. If your testosterone is low, which is common after 50, it can absolutely affect your firmness. And here's what I see just as often in my practice: emotional and psychological causes. And this is so important to understand. When you're stressed about sex, when you're worried about whether you'll be able to perform, When you're distracted by work or money or health concerns, your body can't fully relax into arousal. Your nervous system stays on alert. Your blood vessels don't fully open up. And the result? Softer erections. It's not that there's something physically wrong with you. It's that your mind and body aren't in sync. And here's the really frustrating part. Once you start worrying about your erections, that worry itself makes the problem worse. It becomes a cycle. You have one experience where you're not as hard as you'd like. So the next time you're anxious about it, which makes you less hard, which makes you more anxious, and on and on. This is why I always tell my patients, sexual function is never just physical. It's always a combination of body and mind. And that's actually good news, because it means there are multiple ways to approach the problem. Now let me share something incredibly valuable that you can do at home starting tomorrow morning. It's called the Morning Wood Test, and it's one of the best free health checks you'll ever have. Here's what most men don't know. Waking up with an erection, what we casually call morning wood, was actually a powerful sign that your body is working well. It means your testosterone levels are healthy, your blood flow is strong, and your nervous system is balanced. During sleep, especially during deep sleep and dreaming, your body naturally gets erections several times throughout the night. This is your body's way of exercising the tissue, keeping blood flowing, and maintaining health. And the one you notice when you wake up, that's just the last one of the night. So here's your free health test. For the next week or two, when you wake up, notice, do you have an erection? And if so, how hard is it? Use that same 1 to 4 scale we talked about earlier. Grade 4, rock hard, equals excellent sign. Your body is functioning really well. Grade 3, mostly hard, equals still very good. Nothing to worry about here. Grade 2, somewhat hard. This might be worth paying attention to, especially if it's consistent. Grade 1, barely hard, or no erection at all. This is your body's way of saying something might need attention. Now, here's what's important. If you notice you're not getting morning erections for several days in a row, let's say a week or two, that's a signal. It could be stress, it could be poor sleep, it could be a sign of circulation issues, or it could be low testosterone or a side effect from medication. It doesn't mean you're broken. It means your body is asking for some help. And the earlier you catch these signals, the easier they are to address. You don't need to keep a detailed journal unless you want to. Just notice. Pay attention. Your body is giving you information every single morning for free. All you have to do is listen. And if you notice a pattern that concerns you, that's when you bring it up with your doctor. You can say, hey, I've noticed I'm not getting morning erections like I used to. And that gives your doctor incredibly useful information to start helping you. Now let's talk about something that affects millions of men, but rarely gets discussed openly. Medications that can affect your erections. One of the most common culprits is a class of medications called SSRIs. Those are antidepressants that many people take for depression or anxiety. Medications like Prozac, Zoloft, Lexapro, and others. These can absolutely affect your sex life. They can lower your desire, make it harder to get firm, affect how long it takes to finish, or even make it difficult to orgasm. But here's what you need to know. It's dose dependent. That means the higher the dose, the more likely you are to have side effects. Some men notice problems at low doses. Others don't notice anything until they're on a higher dose. And here's the good news. There are alternatives. Some antidepressants have fewer sexual side effects, and sometimes just lowering your dose a little bit can make a big difference. But you have to tell your doctor. They know these medications can cause these problems. They're trained to help you balance your mental health needs with your sexual health needs. The same is true for blood pressure medications, some prostate medications, and even certain allergy medicines. They can all affect your erections. But there are almost always alternatives or adjustments that can help. The key is being honest with your doctor. Say, I've noticed this change since I started this medication. Don't suffer in silence hoping it will go away. Your doctor wants to help you, but they can't if they don't know what's going on. Here's something I wish more men understood. You are the quarterback of your own healthcare, not your doctor, you. What does that mean? It means you're the one who knows your body best. You're the one who notices changes. You're the one who has to speak up and ask for help. And you're the one who has the legal right to access all your medical records and share them between doctors. If you're seeing multiple doctors, maybe a primary care doctor, a urologist, a psychiatrist, they should be communicating with each other about your care. Sometimes they do that automatically, especially if they're in the same medical system. But sometimes you need to be the bridge. You can say to your urologist, I'm also seeing a psychiatrist for depression. Can you talk to them about my medications? Or you can ask for copies of your visit notes and share them with your other doctors yourself. Most doctors now have patient portals where you can see your test results, read the notes from your visits, and message your doctor directly. Use these tools. Don't be passive. Don't assume everyone is talking to each other. Make sure they are. And if you're having sexual side effects from a medication, bring it up. I know it feels awkward. I know it's not easy to say, hey doc, since I started this medication, I can't get hard anymore. But your doctor has heard it before, many, many times, and they want to help you. You deserve to have both good mental health and good sexual health. You don't have to choose one or the other. There are solutions, but you have to speak up to find them. Let me wrap this up with what I really want you to take away from this conversation. First, erection hardness matters, but not in the way you might think. It matters as a signal, a way your body communicates with you about your overall health. It's not about being perfect or rock hard every single time. It's about noticing patterns and listening to what your body is telling you. Second, changes in your erections aren't just part of getting older that you have to accept. They're often treatable. Whether the cause is physical, emotional, or related to medication, there are solutions. You don't have to just live with it. Third, you're not alone in this. If you're experiencing softer erections, less frequent morning wood, or concerns about your sexual performance, millions of other men are going through the same thing. It's not something to be ashamed of. It's something to address. And finally, you have more power than you realize. You can use the morning wood test starting tomorrow. You can track your own patterns. You can speak up to your doctors. You can advocate for yourself. You can be an active participant in your own health, not a passive patient waiting for someone else to fix you. Your body is trying to help you. The signals it's sending, whether that's softer erections, missing morning wood, or changes in your desire, those aren't failures. They're information. And when you listen to that information and take action, you can absolutely improve things. Thank you for being here today and for caring enough about your health to watch this video. If this resonated with you, please share it with someone who might need to hear it. And if you're not subscribed yet, I'd love for you to join this community where we talk honestly and openly about men's health. I'm Dr. Rachel Morgan, and I want you to remember, you deserve great sex, strong health, and a body that works for you. Take care of yourself. You're absolutely worth it.